Hi, everyone. I'm Dr. Srinath Kumar, Group Head of Emergency Medicine, Yashoda Hospitals, and the Treasurer for International Federation of Emergency Medicine and Asian Society of Emergency Medicine. I'm also the Academic Council Chair for the Society for Emergency Medicine India. I take this pleasure today to introduce one of our speakers. He is well known across the world and is a very good teacher, very good orator, and his name is none other than Dr. Luis Garcia-Castrillo. He's an intensivist medical specialty, doctor in medicine. He's an associate professor, Cantabria University. And also he had in multiple roles. He's an editor, he's a researcher, multiple publications on his name. It's very good to hear from him today's topic about burnout across different emergency departments, because we as emergency physicians, we know how much we work and what are the things we have to take care of, which is important to know from such a great personality. Over to you, Dr. Luis Garcia.
Thank you. Thank you a lot for the introduction that you have done. And also for inviting me to do this webinar. It's a big pleasure. There are another position that I would like to reflect or to highlight before I start my talk. I was during the last 25 years the director of a busy emergency department, so this topic of burnout is very familiar to me and to my colleagues. So after saying this, I will go through my presentation. This presentation is based on a survey that was done 1 year ago in the international setting. Also, your colleagues and probably some of those who are watching today, the presentation took part on that activity and complete the survey. So I have to thank them first of all. And it's supported by USEN. As Srinath says, I am the past president of the European Society for Emergency Medicine. So it's a pleasure for me to disseminate this activity of the society. Well, the first thing is that in the past years, we are really familiar with the concept of burnout. But for the purposes of research, we need to clarify certain aspects before we start talking about it. Burnout, as you all know, is a pervasive problem among all health professionals. I would say that it affects doctors, nurses, and also paramedics in different levels, but all of them are affected by this situation, by this issue. For research purposes, we are going to characterize the burnout affecting 3 different domains of the well-being of the professionals. The first domain is going to be the losing of the enthusiasm for work. This is denominated as emotional exhaustion. People feels that they have lose the pleasure that they have of doing their normal activities, and they feel all the time tired, and they are always focusing on the negative aspects. They are not looking the positive aspects of the activity. The other main domain that we are going to work with is the personalization. We lose, as professionals, we lose the personal contact with our patients. We lose the human aspects of our activity, and that really produce a negative effect in our relationships with our patients, but not only with the patients, also with our colleagues and also with the family. So it is an aspect that really affects us deeply. And the last domain that we are going to talk about is the feeling that the work is not longer meaningful, that this is not going to produce any benefit in our personal evolution. And this creates a sensation that our activity means nothing for us, and we lose interest in what we are doing. There are many research projects that probably you have been in contact before this talk. And they have been estimating how much the burnout is affecting the health professionals. It depends on the way of measuring the burnout. You will find different prevalences of this problem across the health professionals. But we can say that one of every three professionals, in this case physicians, are experiencing at least a moderate level of burnout. So with this in mind, let us move forward and let us compare our specialty with other specialties. And in this link, that is a report that is produced by the United States College of Physicians. The information from this year, we have this graph here that reflects that emergency medicine is in the top rank with a figure of 60% of the professionals being affected. You can compare with the cardiologists that they have a little bit more than 40. After emergency medicine is critical care and obstetrics and gynecology. So we can say that our specialty is in higher risk of suffering from burnout. If we take a look to the next slide and we talk about the different countries, if this is a problem that is occurring everywhere, or just is a problem from the United States, or a problem from Europe, or a problem from India, we can see that every country is affected. Here we have some figures from Europe, from 5 different countries from Europe, and we can see that there is a relevant difference in between the countries. While France and Germany declare a burnout of 30%, you can see that United Kingdom and also United States as comparison have a much higher levels of burnout, but really nearly 2 times more level in UK if you compare with France. So there should be some reason, or is the problem of how this is measured, there should be some local reasons why the professionals in certain settings are more affected than others. I hope that after this presentation, we can clarify a little bit why this is happening. Well, and this very dense slide try to provide you with some facts. The first thing is that this problem is increasing during the last years. We can see that from year 2022 to year 2023, there has been an increase in 6% in the level of burnout. And this is significant because the methodology is the same across this last year. So this is a problem, this is increasing in our profession. The second thing is that females seems to be more affected than males. And this is also something that we are going to talk about in the results of the surveys. The next fact is that there are certain reasons why burnout is occurring, and they have been highlighted by many publications. And one of the main reasons that is in the top rank of the reasons for creating burnout is the bureaucracy and the implementation of the informatic systems and the electronic health history and all the aspects that physicians and also nurses needs to face regarding these administrative aspects. Another very important, and probably is the second aspect in the rank, is the lack of respect from other co-workers. And probably you have faced this several times in your career. Emergency medicine seems, in the perspective of other professionals, as a second line specialty. And this is causing effect in our professionals, mostly in the young ones, when they see this respect from other specialties. And of course, there is a personality. The type of work that we do usually requires certain abilities and certain personality that are better adapted than others. There are other aspects that, from the perspective of the physicians, they think that this can improve the level of burnout. Of course, increasing compensation probably is a very good incentive to reduce this, but probably in certain countries this is not possible. The schedule of work, the work schedule, is also a matter of concern. The limitations or the contradictions with the family life and the work schedule is always appearing as an aspect that can improve or modify in the positive way the level of burnout. And finally, the respect in between us is also another factor that probably deteriorates the relations in between our colleagues. And this is a problem that probably we can face with a better understanding of this problem and the need of support from our colleagues in our daily work. Well, this is a picture of how is burnout seen actually. And with this idea in mind, and with the perspective that COVID probably has deteriorated the level of burnout in the emergency departments, in the overall health system, but specifically in the emergency department, using for the past year Emergency Medicine Day creates or develops and disseminates a survey focusing on burnout, and that the survey was sent to more than 40,000 links that we have in our distribution list. As I told you in the introduction of this talk, India was included in this group, and I again thank for taking part in this survey. The survey was open from January to February. And after the closing of the survey, we have received close to 2,000 responses from 89 different countries. Due to the problems with the quality of the responses, we were only able to use 1,857 responses to analyze the results. We try to overcome the problem that I mentioned at the beginning. The level of burnout depends on how you measure it. There is a validated methodology to measure the burnout that has been developed by Maslach. There is a survey with different questions. This questionnaire covers the three domains that we talk at the beginning. It covers the emotional exhaustion perception, the personalization perception, and the personal accomplishment perception. And it ranks with numbers the level of deterioration of these domains. The level of deterioration that can be related to burnout, and it is the score is able to identify if a specific person, depending on the responses that they are providing, they have low level of burnout, moderated level, or high level, with the scales that are different for each of these domains. So we use this model that it seems to be validated in different countries, different settings, and it's well known by other researchers and provides a very accurate level of comparing in between countries or comparing in between professions. Maslach is this lady that is here, is famous for this achievement. And as I told you, it's a well-known methodology. The problem is that there is not agreement how to use this score. You can use the cutting points of the three domains. Usually the researchers, they only use two domains, the personalization and the emotional exhaustion. This is what we did it. And we define burnout when or in the personalization score or in the emotional exhaustion score, the person ranks at the high level of burnout. So the cutting points for these domains have been seen in the previous slide. So what we did is to define burnout when in the domain of the personalization or in the domain of emotional exhaustions, the person crosses the cutting point of high risk of burnout. This high risk of burnout usually corresponds, by previous studies have been demonstrated this, to the situation in which the professionals looks for external support or external advice to their situation. So this is a way of identifying how deteriorated a person can be if they need to look for external help. So this is to highlight that we are using the combination of cutting the cross line of the personalization or emotional exhaustion. That is what we did it in our survey. Well, here we have the distribution of these 89 countries. You see that India is here included. Unfortunately, not every country provides enough information, enough responses. So for comparing countries, we only use those countries in which there have been more than 20 responses per country. Of course, this is an arbitrary number, mainly knowing that for countries like India, the same number of responses is not like that number of responses from Leicester, in which there are few doctors living over there. But in any case, this is how it was done. In Europe, most of the countries were represented. Again, the countries with more responses were UK, Portugal, Italy, Switzerland. Then it comes Spain, Germany, etc. So now it comes the results of this survey. As I told you, we are going to report about 1,857 properly fulfilled responses. 52% of the responders were males and 48% they were females. Most of the responders, actually 86%, they were physicians, and only 12% they were nurses. This is a limitation of the study because nurses are not well represented in this survey. Probably our distribution list were not focusing enough in the nurses, and we have to solve that for future surveys. Most of the responders, they were working on the emergency departments, 73%, but close to 20% they were working in the pre-hospital setting. And this is important because it's nice to compare if the level of burnout is going to be the same in both settings. So this is the description of the responders. And here it comes the description of the situation of the domains. Remember that we are only going to use depersonalization and emotional exhaustion for our analysis, but here I have also report on personal accomplishment, how it has been deteriorated. In red is the cutting point, and I have report here the percentiles, and you can see that for the personalization and emotional exhaustion, over the percentile 25, they are affected. So this is an important finding. For personal accomplished, the level of affectation is lower, and this is also an important finding. But you can see how many responders are reaching the cutting point of burnout. This is impressive for this survey. This is a graph that compares the relation in between the two domains that we have used, the personalization and emotional exhaustion, and they are plotted by countries. And you can see that there are some countries that are really far away from this correlation line, but most of them, they are on the correlation line. Again, I have to tell you that we have used countries with enough number of responses to do this correlation. The idea was that not every country, every language has been the mass lag inventory has been validated, so we can suspect that the validity in certain countries is not so good. But here it's nice to see that there is a good correlation in between them. So probably the validity of this type of inventory of questionnaire can be assumed. Now, here we have the different countries to take a look to those who have reported enough responses. India is out because India unfortunately didn't reach the required number to be in the countries in which we were able to use the information to compare. And you can see that the rank of burnout goes from as low as Spain as 42% and as high to Slovenia as 94%. So there is a big variation, a huge variation, I will say. UK again is higher than Spain and higher than other countries in Europe. The highest ones are Slovenia, Lithuania, Hungary, France, Italy, Turkey, Albania, Portugal. And in the lower part, we have Sweden, Austria, Spain, Belgium, Switzerland, and Romania. Probably immediately you will take a look to this group of countries in which the wealth situation is well known. But here you have Spain. Spain is not a wealthy country, and probably this is not going to explain the wealthy, is not going to explain the situation of burnout. So we can say from this graph that we have a huge difference in between the country. In India, with the number of reporters that you have sent, the level is 42. So in the rank of the lower rank in Europe. And now let us take a look what are the factors that we found in this survey. Remember that we know from the facts that males are more affected than females with this problem. And this is the same that what we found. While the males, the level of burnout in this sample was 59%, for the females, it was 65%. Just to remember you, because I have not mentioned, that the overall burnout level found in the survey was 62%. So 62% of the responders are in the level of burnout that they will probably need external help to overcome their situation. So females, they have more, but not two more. The odds ratio is 1.26 with a very narrow confidence interval, and the lower limit is very close to 1. So it is the difference is significant, but the clinical relevance probably is not so important. The profession, although we have not many nurses, not as many as doctors, we also have paramedics and other groups like public health services, administration, etc., that have fulfilled the survey, so we can use them to compare. And we can see that the physicians, the level of burnout in the physicians is 60, while the nurses is 72. And this is statistically significant. So we know that the nurses suffer more burnout than physicians as they declare in this survey. The difference is significant, and as you can see here, the odds ratio is 1.75, and this is significant. So the risk of having burnout if you are a nurse is much higher than if you are a physician. The paramedics, they also have higher burnout level, but it's not statistically significant in this case. While others, others dedicated to, let us call it, not clinical activities, not direct contact with the patients, or direct contact that is not involved in medical decisions, they are suffering less burnout, as you can see here. But due to the lower number of responses in this group, the difference is not statistically significant. So we can say that females are suffering more, as others have said previously, that physicians compare with nurses suffer less, and probably others with no direct contact are suffering less. Working responsibilities. Here we have split the group in the group who are in the trainee period and compare with the staff and compare with the administration. And you can see that the trainees, people in the trainee period, they have higher burnout risk. And it is not statistical significant, but the difference is important, 5 points. The administration, they have less burnout, and this is statistical significant. And we come back to our previous discussion. Probably those with no direct contact with patients, like the administration, they have less risk of burnout if you compare with those with direct. But this is important to keep in mind. Trainees seems to be in higher risk than staff. So probably the young people are a group in which we have to focus to try to control this situation, because they have higher risks. And this is clearly seen when we split the responses in the years of contract. Let us say the experience of the professionals. Those with more than 20 years, we can say a long experience, they have the lowest burnout rate. And if you see, as you decrease in your experience, you go down to 60 when you are in between 11 and 20 years, down to 67 when you are in between 5 and 10, and you go down to 74 if you have less than 5 years of experience. This is very clear. The experience allows you to overcome the situation, and also you are in less risk of getting burnout when you have gained experience in your profession. And all this is statistically significant for all the cutting points. So again, we need to take care of what is going on with the young professionals, because they are in the higher risk of burnout. The working place, comparing mainly the emergency department, the pre-hospital, the EMS system, and in certain places there is a combination. The professional, the physicians, they work in the emergency department part-time and part-time in the pre-hospital setting. And there are others. Others are mainly working in training centers, administration, etc. And if you compare, you can say that the highest risk or the highest rank of burnout is in the emergency department. The EMS, they have lower risk with statistical significant value. Those who work in combination, although they are in contact in the emergency department, but they also work in the pre-hospital setting, they have also lower rate than if they only work in the emergency department, also with statistical significant. And others, they have the lowest one. So again, probably being outside of the direct contact, and also sharing the activities, sharing the training, the activity in the emergency department, the activity in the pre-hospital, is a protective way of precluding the burnout risk in our professions. Other factors, and we are reaching the end of the risk factors, and this is one of the main one. The understaffed centers, do they have higher risk of having burnout in their professionals compared with those centers in which the staff is enough to cope with the normal situation of the emergency department? If there is no understaff, they have the lowest rate of burnout, 37. If sometimes you have a shortage of professionals, you have a 33 rate of burnout. But if often you have a shortage of professionals in your center, you have 70%. And this is statistical significant. But you can see here that the odds ratio, that means the probability of being in the burnout group, is 10 times higher if you are working in an emergency department that are systematically or oftenly understaffed. And this is very important, not only for the physicians, but also for the responsibles of the emergency department. They should know that the understaffed situation is putting their professionals in this risk. But the risk is really considerable, as you can see. If you have frequently ideas of looking for another position. This can be because you have suffered burnout or you are in a burnout situation. Let us explore what this means comparing work change thoughts and the situation of burnout. If you never think on that, well, this is clear. Probably you don't think because you are working in a place in which you are comfortable and you will not like to change that situation. The level of burnout is the lowest one, 40%. If sometimes you have to think in changing the working place, you have a higher rate of burnout, 64, and if it is often 80, 87. And again, if you are thinking, if you are thinking frequently in changing the working place, you are in a higher risk, 4 times higher than if you are not thinking on this. So this is needed. But finally, let us see what the responders report about the support that they receive for this situation, for the burnout. You see that psychological support is received on place or by phone, or they don't know how to receive this support, or they don't have support for them. And you can see that the whole series, 30% they've received support on place, 11% by phone, and they don't receive support 43. And this is really surprising. This figure is really high due to the well-known risk of having burnout in the specialty. The conditions of the emergency department is prone to burnout, and we need to have support. It's important to have it on place, but by phone can be useful. But we have received this information from the responders. In 43% of the cases, there is not support. This is this figure is higher in doctors, as you can see, than in nurses. Okay, so these are the main results of the survey. Let us wrap up this information with some thoughts. We know that the rate of burnout in the population that we have surveyed is 62%. Is really high. Probably, as we have seen in the beginning, the highest if we compare with other specialties. And also we know that it has increased after the COVID period. If you have a burnout, you are trying to change your working position. 65% of those with burnout, they try to look for a new place. So that means that you are going to move. And we know that if you have an understaffed situation, more than the half of the professionals working there, they are going to be suffering for burnout. So this is a vicious cycle. You have burnout, you try to move, the setting reduces the workforce, that this creates again more burnout, and then we need to, in a certain way, to cut this vicious cycle to reduce the number of burnout and the mobility of the professionals, because we are losing good professionals that are moving and looking for other working places. USEM, after seeing these results past year, we published some kind of decalogue. It's not a decalogue because there are 12 points, but 12 aspects that we can touch to try to overcome the problem of the burnout. Probably is not exclusive of emergency medicine. It can be applied to other settings, because there are general things that come from the results of this and other surveys. So adequate number of staff, this is clear. It's not just the number, but also the competence. And we have seen that the young people, because they don't have experience or they don't have competence, they are suffering more than others. The respect from the professionals is one of the claims that we see frequently in other surveys. We have not explored this in this one. The call system and the organization is also important. That is related to the working hours, the structure and the equipment, and other support and infrastructures are relevant and very important to consider. and the aspects that are related to comfort to the professionals, that space for rest, refreshment during the shifts, facilities for the parents and the babies, for the patients, is also an aspect that should be considered when one responsible of an emergency department try to solve the problem of the burnout. This is a good idea to go through this list. And finally, we have the hospital policies that should not be discriminating by race, religion, or gender, and to provide adequate psychological and emotional support, because as we have seen, the responders report that the psychological support is absent in 40% of the cases in their centers. And with this last slide, I hope that I have provided a good overview that will make interest in this topic from your side, and try to improve the situation in your centers. But it is important to understand that this phrase is at least in my opinion, is reflecting the reality. And it says, to be able to build the systems we need, we must face an unpleasant truth. Our healthcare institutions, as they exist today, are part of the problem rather than the solution. Thank you for your attention, and I will be more than pleased to answer your questions if you consider of interest. Thank you.
Hello.
Hello.
Yeah, if there are any questions, please put it into the chat box. Speaker Professor Lewis will be speaking.
Yeah, I've seen that as per the statistics, about 42% have been reporting burnout in India, but the real scenario will be almost, I can say, close to 100% probably. Our Indians are so used to this hard work that they don't feel like the thing they are going through is called burnout. That's probably because of lack of awareness. But most of them are actually going through the stress, not just from the patients and the attendants. The demands are quite high in India. So as soon as they enter the ED, they want someone to see immediately. They don't know what's priority 1, 2, 3, and by when a doctor needs to see them. So as soon as they enter, they want us to actually evaluate immediately. So if we tell them that it's not an emergency, then they'll say, why did we come to emergency? It's an emergency for us. So that way we are facing not just from the patients and attendants, even some of the administrations are also like, they'll be forcing the ER physicians, especially in corporate environment. But not everyone gets a friendly environment at workplace. Some of them actually may have not had enough time to even respond to your survey.
In any case, thank you for those who try to respond. The scenario is common in many places. Probably as in my country, because I was really surprised. We have a lot of responses from Spain, so the figure is reflecting the reality. In your case, I am sure that is not reflecting the reality, because I mean, the number was low. That was the reason why we didn't include countries with a low number of responses. But in any case, I think it's an important aspect to highlight this situation and to make everybody aware of this situation, because burnout is affecting, of course, our personal life. It's affecting our health. It's creating a continuous, chronic stress situation. And this is another way of defining burnout, chronic stress situation. But also is affecting our performance in the emergency department. The quality of our activities are lower if we are in this group of professionals. The personalization is an important aspect. We don't have this human feeling humanitarian feeling for the patient, but that we should. So we have to have a culture of trying to identify, try to do prevention, let us call it. That is a word that we really like in health. Prevention in burnout, because it really affects professionals, families, and patients. And this is important. In the other side, as you probably know, we are actually doing another survey regarding safety. In this case, India has reported the enough numbers to be included in the group. So next time you invite me to talk about safety, India will be in the group of countries that we will compare one in between the others and try to see why some countries are more safe than others. So in any case, I thank you for your collaboration. Doesn't matter if you provide a small number of responses or high number of responses, they are always welcome, and it's a pleasure always to hear from you. I am taking a look to the chat and I cannot see questions on the chat.
Yeah, probably this topic. Okay, one message. Some patients attendants seem to be aggressive and have arrogant reply to ER physicians. So that's the case with most of the EDs. Here, people have
highlighted
to abuse.
It is highlighted in the introduction of the survey, and not in the survey, but we have to be aware, and this is important, not only for the responsibles but also for the rest of the staff, to know that the youngs are the ones who are in more risk, and these attitudes are really negative and should be avoided in whatever the way. Probably to have to inform about burnout, to have to present that data like this, or to describe the reasons of burnout or the picture of burnout is important in all the emergency departments. And we are not doing this. We are talking about diseases because we really like to know how to diagnose and to treat. We are really fond of that, and we are not so fond of this other type of aspects. But this is affecting our health, the health of our families, and the health of our patients.
Yeah, more than the doctors. In fact, our nursing staff suffers a lot, especially in India, in private sector.
Yeah, the report says that nurses are suffering more. They have more risk of burnout. But you see, there are more dramatic reports than this one. In certain countries, they have been discussing the risk of suicide, the risk of drug abuse, and other disturbances of the professionals, and this is affecting doctors and nurses.
I think we don't have any more questions.
Well, to finalize, I would like to thank again for inviting me. It's a pleasure to disseminate these activities. And as I told you, this year we are doing a survey regarding safety. That is also a topic related to burnout. If your center is not safe, the risk of burnout is higher. And the survey is still open. So, but I told you, actually, India has enough responses, but more will be nice.
Sure. Thank you so much, sir. This is not so often discussed topic. So thanks for enlightening us.
Thank you for inviting.
Thank you, Professor Luis Garcia. It was a